let's talk with our GP trainer, Dr. Jyotis, and she's one of the GP trainers of our Bemax Academy for the last 1 year. Today we can ask her the questions regarding how we are going on with the topics as well as how they are preparing the students for their exams. Okay, ma'am, why doctors has to write the medical licensing exam when they migrate to Gulf countries?
So we know the medical licensing exams that a general practitioner has to give. So there are different exams like MOH, DHA or HAAD and Prometric exams that is given by different countries. So it's based on their regulations. So the governments are conducting it. And as a doctor from India or any other country, we have to pass this exam, and it's according to their rules and regulations.
Okay, ma'am, could you please tell me the live classes timing of GP doctors?
So we have the timings from 8 o'clock to 10 o'clock, that is in the evening. And doctors from any place, anywhere can join, because it's an online live class and it will be very beneficial rather than the recorded sections.
Okay, ma'am, it's anyway that time is very good, but if the doctors have a busy schedule, will be there, maybe they have night shift, they will miss the class, then how should they maintain if they will miss the class?
Sure. So it's one of the concern of the doctors that their duty times are not correlating with the live classes. They might miss the classes. So the doctors doesn't need to be concerned, because we have live recorded classes that will be available in the application, so they can watch it anytime. And along with that, PDFs are available, so comprehensive PDFs that will help them along with the video classes.
Ma'am, can you please tell us how you are going on to handling the topics which are the exam oriented topics that is very important for the students?
So for the exams, we know they are going to test your clinical approach to the cases. So case scenarios will be given and your management skills. So your next step in the management is mostly asked in the question. So we have different subjects which are important, would be respiratory and the cardiac cardiology. Then we have the obstetrics and gynecology. Then we have pediatrics. So in all this, they are going to test the important topics, the core things that you should be aware of. Like in case of hypertension, like the NIHSS scoring system, and the stroke and the window period you should be aware of. Like in emergency medicine and approach is very important, so you should be aware about the shock, its classification, burns, so all of these. And then we have psychiatry, the different mental disorders. Then we have subjects like ENT, neurology. So our classes are going to give a complete idea for a doctor how to approach these questions and how to manage the patients. And definitely a doctor must be aware about how and why should not a drug be given to a patient. So the contraindications, especially when it comes to pregnancy, the pregnant woman, right? So for example, that the anti-seizure drug like valproate, it is contraindicated in a patient of PCOS because it is causing hirsutism. So such questions are deeply discussed, and those are the tips that we actually give in the classes.
Thank you, ma'am. Okay, ma'am, I want another question. Would you get a feedback from the students about the Bemax application and what the benefits they are getting through that application? Because we are scheduled that application, especially topics, MCQs and even tests also for them. And we got so many Google reviews from the recent required score achieved students. They told us that this is very beneficial for them for practicing this one. So what about your opinion about that one, ma'am?
So when a student actually get the application, they have access to, like I said, the video section, video recorded sections will be there. There will be comprehensive PDFs available so that they can improve their knowledge. And along with that, we know the theory classes are not just enough. There should be testing of their knowledge. So there are questions available so they can go and give the questions, and we have mock exams. So the mock exams are going to be just like how your exams you are going to attend it. So when you give a particular timing will be given, and you can give the your exam. So by the end of the exam you can go and review all the questions that you have missed or that you marked to review later, and you can go to the option and submit. So when you submit, it will be clearly shown how many correct answers you got, how many wrong answers are there, and the highlight is that for every incorrect answer we are actually providing the explanation. So most of the questions have explanations, very detailed, so that you can identify and rectify your mistakes. So these are the options which are very essential for the doctors that we provide in the application.
Okay, thank you, doctor. I think this session is very useful for the general practitioners, those who wish to migrate to the Gulf countries. We, the Bemax Academy, will provide you the better services, guidances and support, and the well-trained line of doctors will be there with us, will give you the proper guidances and all that. If you wish to purchase our application individually without the live sessions, you can purchase at any time. We, the Bemax Academy, is ready to help you at any time. Thank you.